Hi, my name is Sharon Levin. I'm the Director of Federal Reproductive Health Policy at the National Women's Law Center. Today I'm going to talk to you about the numerous attacks on contraceptive coverage that are happening around the country. This month, the contraceptive coverage provisions of the new health care reform law go into effect. What we need to remember is that this law, and specifically these provisions, are very much under attack. The law, over time, will give almost all women with private insurance access to all FDA-approved forms of contraception with no copay. And this is a tremendous step forward, but there are people out there who want to keep women from getting this coverage and services. Now you might be wondering, how in the 21st century is it that people are trying to keep women from getting birth control? And I know it sounds like something from 1912, not 2012, but here we are. As you may know, the House has voted 33 times to overturn or defund all or part of the health care reform law. And obviously, if it's overturned, women will lose this coverage. But what you may not know is that there have been a number of specific attacks on this provision. The House voted, for example, to allow bosses to opt out of the provision if it bothered their religious beliefs or moral beliefs. Now, what you have to know is there's already an exemption for religious organizations like churches. This is other employers, and the idea that somebody's boss could impose their moral beliefs on their health care needs is not something the American people support. In fact, polling shows that the vast majority of Americans support these provisions. Across the board, they see it as a matter of women's health and not an issue of a boss's religious liberty. This is true not only of independents, but it's true of pro-life voters and of Catholic voters. Let's play this out. If this large loophole was placed in the law and allowed a boss to not supply contraception for moral reasons, that could mean almost anything. And ultimately, this kind of law could mean that the 57 million women who get their insurance through their jobs could lose contraceptive coverage. In addition to the attempts to legislate a loophole, there have been 24 lawsuits brought against the contraceptive coverage provisions. 24 lawsuits. This is a huge number of attacks against a provision that to most people is about basic health care. So, as you're celebrating the new contraceptive coverage provisions this month, we'd like you to do something else. We'd like you to write to Congress, to tell the president, to tell your local newspaper, to tell your friends, to Facebook, to tweet, to do whatever it is you do to talk about what's important to you and say you support contraceptive coverage and that these attacks are wrong. To learn more, visit us at www.nwlc.org. And thanks for watching.